I'm Kathy Porras, and I will be performing oral medication administration video. I'm going to start by verifying the provider's order. So I'm going to make sure that everything is correct by verifying the 6 rights of medication administration: a right patient, right drug, right dose, right time, right route, and documentation. So I'll check the medication order against the MAR, and the provider has ordered the following medications: amoxicillin 250 milligrams, metformin XR 500 milligrams, phenytoin 100 milligrams, ferrous sulfate 65 milligrams, and acetaminophen liquid 500 milligrams in 15 ml. So these are all oral medications, and no dosage calculations are needed for any of them. Okay, I'm going to enter the patient's room and close the door to ensure privacy. Hello, my name is Kathy, and I'm going to be your nurse today. Can you confirm your name and date of birth? Great, thank you. Do you have any known allergies? Okay, so your doctor has prescribed you some medications. So I'm going to do a hand hygiene and put on some gloves. Okay, so we're going to pull up our patient's chart in the room and do our third verification at the bedside. I will also perform any necessary pre-administration assessments, such as checking the blood pressure, pulse, heart rate, and temperature. So let me explain the medications I'm giving to you. So amoxicillin is an antibiotic that used to treat infections, and common side effects include nausea and diarrhea. Okay, so metformin helps control blood sugar in diabetes, and common side effects include headache and dizziness. Okay, so and then phenytoin, it helps prevent seizures, and common side effects includes dizziness or drowsiness. Okay, and then ferrous sulfate is an iron supplement. It may cause constipation or dark stools. And lastly, the acetaminophen, it helps with pain or fever. Common side effects includes nausea and diarrhea. Okay, so if you experience any unusual adverse effects like dizziness or medication allergies or anything out of the ordinary, please let me know right away. Okay, do you have any questions? Okay, perfect. So let's start with the tablets. And please sit upright or lie on your side. Here are your medications. Do you need any water or juice to help you swallow those? Okay, so for the acetaminophen, I will shake the bottle and I will pour 15 ml. Okay, here's your liquid medication. Okay, do you need anything else before I go? Okay, so help the patient get comfortable, adjust the bed, and ensure call light is accessible. I'll now remove my gloves, and I'll do a hand hygiene, close the door behind me to ensure privacy, and document the procedure.